Welcome to While We Were Distracted, the podcast where we explore topics that often get overshadowed in the rush of daily life. Please take a moment to like and subscribe. It really helps.
Imagine this. Millions, maybe even billions of dollars, just vanishing from a system meant to, take care of people when they're vulnerable.
Yeah, it's not just some abstract idea. It's healthcare fraud. It pulls resources away, causes real damage.
Exactly. And today we're doing a deep dive. We've got a specific set of sources looking at recent Medicare fraud cases, stuff uncovered just this year, 2025.
We're pulling from DOJ press releases, reports that kind of lay out the typical fraud schemes.
Right, and a briefing doc that summarizes the key findings from all of that.
Yeah.
So our mission here for you listening is to really pull out the key insights. We want to understand what Medicare fraud actually is, how it's happening right now.
And we're looking particularly at these 39 distinct matters that the sources flagged for 2025.
Exactly. Who's doing it, why it matters to you, and maybe most importantly, what's being done to stop it.
Think of this as like your shortcut to getting your head around this whole messy issue.
Okay, so let's start right there. The basics. What is Medicare fraud, according to these sources?
Well, fundamentally, it's about sending false, fraudulent claims to Medicare, intentionally trying to get paid for things you shouldn't.
Okay, like what kind of things?
It could be billing for services or
Yeah.
items that weren't medically necessary, the patient didn't actually need them, or things that were never provided at all.
Billing for nothing.
Billing for nothing, yeah. Or just billing under completely false pretenses. It's basically deceiving the system to make money.
And you mentioned those 39 matters from 2025. That connects right to this definition, right? That's the scale we're seeing just this year in terms of enforcement actions.
That's the snapshot from 2025, yes.
Yeah.
But the sources give broader context, too. The DOJ's Healthcare Fraud Strike Force. Since 2007, they've charged over, 5,800 defendants?
Wow.
And collectively, those people billed Medicare and private insurers over $30 billion.
$30 billion. That's staggering.
It is. And the cases just highlighted this year. In 2025, they range from schemes involving millions all the way up to one alleged scheme over $200 million.
Okay, let's unpack that. How are they doing it? The sources seem to lay out some common ways, like a playbook.
They do. There are definite patterns. Let's look at the big ones from these 2025 cases.
All right.
First up, a really common one. Billing for medically unnecessary services or items. Ordering something just to bill for it, not because the patient needs it.
Like what? What are some examples?
The reports mention things like unnecessary lab tests, think expensive cancer genetic tests, or those high reimbursing urine drug tests doctors didn't actually want, or durable medical equipment, DME things like orthotic braces, stuff you wear for support.
Okay, got it. Are there specific cases showing this?
Oh yeah. A really vivid one from 2025 involves a Dr. Alexander Baldonado, convicted. $24 million scheme.
$24 million.
Get this, he was ordering hundreds of these expensive cancer genetic tests for Medicare patients, but he did it at COVID-19 testing events.
Wait, people were there for a COVID test?
Exactly, and he's ordering genetic tests. Sources say he often didn't treat them, didn't talk to them, didn't examine them, nothing.
Just order the test.
Just ordered the tests. Plus, he ordered orthotic braces in exchange for cash kickbacks. They even got it on undercover video.
No way.
Yeah. And patients testified they didn't know him or never got any results.
That is audacious. Ordering tests at a totally unrelated event. Wow. Any other examples of this medically unnecessary angle?
Absolutely. We see it with the lab operator, Sharif Khalil.
Yeah.
Convicted in a $4 million scheme.
Okay, what did he do?
He conspired to bill for the highest reimbursing urine drug tests, even when the doctors didn't need or want that level of testing.
Ah, maximizing the payout.
Precisely. And he paid marketers kickbacks for these orders. He hid the payments by routing them through shell companies, basically fake businesses he secretly controlled.
Sneak up.
It gets worse. The sources say he even trained staff inside doctors' offices on how to create orders that weren't medically justified.
Trained them. So, pulling clinic staff into the scheme, is it just doctors and lab guys?
No, it cuts across different provider types.
Yeah.
In Louisiana, a nurse practitioner, Shannon Chapman Ashley, was convicted. $2 million scheme. Same idea.
What did she do?
Ordered medically unnecessary DME, like knee braces, often for patients she hadn't even examined. She got kickbacks for these orders from telehealth companies that were sort of facilitating it. And she signed fake documents claiming she'd consulted the patients to make it look legit.
Okay, so that's billing for stuff people don't need. Now, you also mentioned billing for things that were never provided, like pure fiction.
Exactly. This is where it gets maybe even more straightforwardly criminal.
Hmm.
Billing for services or items that simply did not happen. Zero delivery.
What kind of things fall into that?
Sources give clear examples.
Yeah.
Hospice services that were never actually given to a patient. DME, like those braces, billed for but never delivered.
Right.
Pharmacies, billing for prescriptions they never dispensed. And a big one lately, billing for COVID-19 test kits that patients didn't want or never received.
Okay, let's see some cases.
Take Petros Fichigian, involved in $17 million worth of schemes. He ran sham hospice companies, not real providers.
Fake hospices.
Fake hospices, billing Medicare not just for unnecessary services, but for services that were flat out never provided to anyone.
Wow. And didn't we hear about someone selling patient IDs? Does that fit here?
Yes, Julian Lopez, sentenced in a $3.2 million scheme. His role was getting Medicare beneficiary ID cards, stealing patient info, and selling it
Selling the info to whom?
to a DME company. That company then used those stolen IDs to bill Medicare for orthotic braces.
That they never sent out.
Exactly. Never provided to the beneficiaries whose identities were stolen.
That's a clear pipeline of fraud right there. And those COVID test kit cases sound like they fit this never provided model perfectly.
Absolutely. They're a prime example from these 2025 sources.
Yeah.
Corey Olson, $8.4 million scheme, pleaded guilty. He specifically bought Medicare IDs.
Bought them.
Bought them. Just so he could bill for test kits people didn't ask for or want.
Unbelievable.
And then there's the huge $227 million alleged scheme with Syed Murtuza Kablazada and Syed Mehdi Hussein. They were charged,
$227 million, allegedly.
allegedly, for billing for test kits rarely provided. They apparently used a marketing company to get names hundreds of thousands of beneficiaries. And get this, sources say they even allegedly billed for people who were already dead.
Billing for dead people, that's
Yeah.
something else. What about that pharmacy example?
Right, the four pharmacists,
Yeah.
$13 million conspiracy, they got sentenced
For what?
for billing Medicare, Medicaid, and private insurers for prescription drugs that were never actually dispensed. The system pays, the patient gets nothing.
Okay, so we've got unnecessary services, services never provided. What else ties these together? Kickbacks seem to come up a lot.
Yes, a really significant part weaving through many of these schemes, highlighted in the sources, is the payment and receipt of illegal kickbacks and bribes. It's often the engine driving the fraud.
We saw that with Dr. Baldonado getting cash.
Exactly. And nurse practitioner Chapman Ashley getting payments from telehealth companies. Lab operator Khalil paying marketers. It's all connected.
So the kickback is the payment for the fraudulent order.
Pretty much. The sources make it clear. Money changes hands, specifically for ordering unnecessary things or referring patients for them. It corrupts the whole medical decision-making process.
Yeah, the doctor isn't thinking about the patient, they're thinking about the payment.
Right. Need goes out the window. It's about the kickback.
Okay. Another thing that seems common is messing with people's identities, using stolen, bought, or misused patient or doctor information.
Yes, that's a key enabler for a lot of this. Let's go back to Petros Fichigian, the sham hospice guy with the $17 million schemes.
Right.
He didn't just bill for fake services. He used the personal identifying information, PII, names, Medicare numbers of foreign nationals, to hide who really owned the sham companies.
Yeah.
And to open bank accounts to collect the stolen money. He also stole the names and IDs of doctors, including 2 who were deceased, to falsely sign off on hospice services.
Using dead doctors' IDs.
Yes. And the sources even say he paid another doctor $11,000 to try and cover up using their info fraudulently for separate home health billing.
So actively trying to buy silence and cover his tracks using other people's identities.
Exactly. And remember, Corey Alston, the $8.4 million COVID kit guy.
Yeah, he bought the IDs.
He explicitly purchased Medicare IDs, stolen PII, just to fuel his billing scheme.
And Julian Lopez, the one selling the info.
Right. $3.2 million DME scheme. He got hold of Medicare beneficiary cards and sold that personal info straight to a DME company specifically so they could file fraudulent claims.
It's like identity theft powering Medicare fraud.
It often is. And in that massive alleged $227 million scheme with Kablazada and Hussein.
Hey, COVID kits again.
Yeah. They allegedly used a marketing company to get the PII for hundreds of thousands of people, including, as we said, deceased individuals, just have names to bill under.
Okay, so stealing identities, billing for things not needed or never done. What else? Are there other angles?
Well, sometimes it's about the patient themselves. billing for patients who are simply ineligible for the specific benefit being claimed.
How does that work?
The $3 million settlement with Sod Healthcare is a good example. The allegation was they billed Medicare for hospice patients who weren't actually terminally ill.
Ah, so they didn't qualify for hospice.
Exactly. Hospice is for patients expected to live 6 months or less. If they don't meet that medical criteria, they're ineligible. Billing for them anyway is fraud.
Got it. And that connects back to Fitchett's Inn, too, right? His sham hospices.
Yes, his sham operations also billed for patients who weren't terminally ill. It's another way to wrongly access Medicare funds.
Okay, here's one that sounds complicated. Submitting false diagnosis codes to get more money, especially in Medicare Advantage.
Right, this one is a bit more complex but very significant. Look at the big settlement with Soul Medical Group and related parties, over $62 million.
$62 million. What did they allegedly do?
They allegedly submitted fake diagnosis codes for severe spinal conditions. Specifically, things called spinal enthesopathy and sacroiliitis, serious-sounding spinal issues.
Okay. But the patients didn't actually have these conditions.
That's the allegation.
Yeah.
They billed these codes for patients who did not have them.
Why? What's the point of making up a diagnosis?
Here's the mechanism the sources explain. These fake, severe diagnoses inflate what's called the patient's risk score.
Risk score.
Yeah. Medicare pays Medicare Advantage plans more money for patients who seem sicker, who have higher risk scores, because they're expected to cost more.
So fake diagnosis equals higher risk score.
Or goes higher payments from Medicare to the Advantage plan, and then a chunk of that extra money gets passed down to the provider group, like Soul Medical Group.
So they're gaming the risk. Wow. Creating fake evidence to back up fake diagnoses to get inflated payments, that's layers of deception.
It really is. And finally, fraudsters obviously need to hide all this. So the sources detail methods used to conceal the schemes and launder the money.
Makes sense. How do they do that?
Common tactics include using shell companies, like we mentioned, using third-party bank accounts not directly linked to them, and using nominee owners.
Nominee owners, like putting someone else's name on the business.
Exactly. Someone else is the owner on paper, hiding the real person pulling the strings.
Any examples of this concealment?
We saw it clearly with Petros Fitchegian again. $17 million schemes. He got nearly $7 million in fraudulent funds. And he laundered over $5.3 million of it through like a dozen different shell company and third-party bank accounts, just moving it around to obscure the source.
Covering the trail.
And he used those foreign nationals as the owners on paper for the sham companies right from the start. An attempt to insulate himself.
Right. What about the lab guy? Khalil.
Sharif Khalil, yeah. $4 million scheme. He hid the kickbacks. He paid marketers by funneling the money through marketing companies that looked independent, but he secretly controlled them. Another layer of disguise.
Rating distance.
And in that huge alleged $227 million case, Kavlazada and Hussein, they allegedly put foreign nationals in place as nominee owners at the labs. And the sources suggest this was done with the specific understanding that these nominees would just flee the country if investigators showed up.
Just disappear, making it harder to track the real operator.
Exactly. A way to try and derail the investigation.
Okay, so we've seen how the schemes, the concealment, but who are these people? The sources must give some idea of the range of individuals involved.
They do. It's a pretty broad mix, actually. You've got licensed professionals, doctors, nurse practitioners. You have business owners, people running labs, pharmacies, DME suppliers. Then you have people involved more in the mechanics, selling stolen IDs, acting as those nominee owners, maybe money launderers, and even foreign nationals sometimes roped in.
And the companies themselves.
And the entities themselves, yeah. The medical groups, the labs, the pharmacies. It spans individuals and corporate structures.
So it's complex, which brings us to the big question. Why should you, listening right now, really care about all this beyond the, wow factor of the huge numbers?
Yeah, this raises that important question. Why is this so damaging? The sources spell it out pretty clearly.
Okay, what are the main impacts?
First, the obvious one.
Yeah.
It wastes millions, potentially billions of taxpayer dollars. All those figures we talked about.
Yeah.
That's your money being stolen, not used for healthcare.
Right. Money down the drain.
Second, it diverts limited resources. Healthcare money, staff time, supplies, it's not infinite. Fraud pulls those resources away from people who genuinely need care.
Taking away from legitimate needs.
Third, and this is crucial, it causes significant harm to patients. Fraudsters often prey on vulnerable people, the elderly, the disabled. They might push unnecessary treatments, maybe even harmful ones, or just steal their identity, causing chaos.
Real harm to real people.
Absolutely.
Yeah.
And finally, it undermines and corrupts medical decisions. When money, not need, drives care, it erodes trust. Trust in doctors, trust in the whole system.
Yeah, that trust is fundamental. Okay,
Mm.
so it's a massive problem, huge costs, real harm. But it's not like nothing's being done right. The sources talk about efforts to fight back.
Oh, absolutely not. It's a major focus. The U.S. Department of Justice, working very closely with partners like the FBI and HHS-OIG, that's the Health and Human Services Inspector General,
Right.
they are seriously committed to fighting healthcare fraud.
Yeah.
They have key tools like that healthcare fraud strike force program we mentioned.
Which leads a lot of these investigations.
Exactly. And the False Claims Act, that's a really important
The
one.
False Claims Act, how does that work?
It's a powerful law, often used for civil settlements, not just criminal charges. And a key part is its qui tam provisions, basically whistleblower provisions.
Whistleblower, meaning insiders can report fraud.
Yes. It allows private individuals, often employees who see fraud happening, to file a lawsuit on behalf of the U.S. government. And if the government wins the case and recovers money, the whistleblower gets a share of that recovery. It's a strong incentive to come forward.
So people inside these fraudulent operations have a reason to speak up.
Exactly. And those settlements we talked about, Side Healthcare for $3 million, Soul Medical Group for over $62 million, both of those were qui tam cases, started by whistleblowers.
That's really interesting. A powerful tool.
It is. And beyond lawsuits, the sources mention coordination with CMS, the agency that runs Medicare, to hit fraudsters with administrative penalties too. Things like suspending their Medicare payments or kicking them out of the program entirely.
So multiple ways to hold them accountable.
Right. And for anyone listening who might suspect something isn't right, fraud, waste, abuse in Medicare or other programs, the sources give a number. You can report tips confidentially to HHS.
What's the number?
It's 800-HHS-TIP-PS. That's 800-447-8477.
Good to know. Okay, so we've taken a deep dive into these 2025 cases. We've seen the sheer variety, the, frankly, creativity, and the scale of these Medicare fraud schemes.
Yeah, from billing for stuff never done to unnecessary services, complex identity theft, kickbacks, manipulating those diagnosis codes. It covers a lot of ground.
And these recent cases really underscore how adaptable these criminals are, always looking for new ways to exploit the system.
Definitely. They find loopholes, they exploit new technologies or program rules, and the cost, as we've seen, is enormous billions in taxpayer money over time and real harm to patients who depend on Medicare.
So wrapping this up, what does it all mean for you, the listener? Maybe it's just a stark reminder that we all need to be vigilant about protecting these public resources.
And the importance of reporting it if you see something suspicious. That HHS TPS line is there for a reason.
It also leaves us with a question, doesn't it?
It does. This raises an important question for the future. As healthcare keeps changing, more telehealth, evolving Medicare Advantage plans, new technologies, how does the fight against fraud keep up?
Right. How do enforcement and prevention adapt to stay ahead of schemes that are only going to get more sophisticated?
Please take a moment to like and subscribe. It really helps.